Good evening, colleagues. Welcome to our monthly physician-to-physician call with Riverside County Health Officer, Dr. Geoffrey Leung. The call gives local physicians a COVID-19 update and opportunity to ask questions. I'll hand over to Dr. Geoffrey Leung. Good evening, Dr. Leung.
Thank you, Dr. Singhvi. Thank you. Just to share some brief updates first, and then we can jump into the questions. For those of you kind of following all of the news, there's been quite a few developments, even just during the past couple weeks. And as a reminder, kind of putting things in perspective and just moving chronologically, it was just on Monday, July 26th, that we had a state health officer order. And this basically said that all state workers in California and all healthcare workers in California would need to either start proving that they've been fully vaccinated or demonstrate or participate in COVID testing and show negative testing on at least a weekly basis. And so that state health officer order said that this needed to begin starting August 9th. And that organizations and employers needed to be in full compliance by August 23rd. And then we'll come back to this in a moment. Then the day after, on the 27th, end of July, the CDC came out with updated masking guidelines, recommending indoor masking for all areas with higher substantial transmission. And that really applied to over 90% of California. So the day after, on July 28th, the California Department of Public Health came out with updated masking guidelines, basically recommending universal indoor masking. And their reasoning was that, first of all, if most of the state is already covered in that CDC recommendation, it's not a big stretch to cover the whole state. And all of this was done, of course, out of concern of rising cases and the more contagious Delta variant. In California, just as a reminder, this is a recommendation for universal indoor masking, but there are settings in which masking is absolutely required. So that includes settings like K through 12 schools, transportation hubs, healthcare facilities, shelters, correctional facilities, adult day centers, for example. And then just last week, at the end of the week on August 5th, 2 state health officer orders came out. And the first one had to do with healthcare workers now being required to be fully vaccinated by September 30th. So this sounds similar to the health officer order on the 26th, but instead of now being able to choose either testing or vaccination, it means that by September 30th, all healthcare workers need to be fully vaccinated, or they have to have asked for a medical or a religious exemption. And so healthcare workers is broadly defined and includes general acute care hospitals, skilled nursing facilities, intermediate care facilities, acute psychiatric hospitals, adult day health centers, programs in which you have all-inclusive care for the elderly, like the PACE program, ambulatory surgery centers, chemical dependency recovery hospitals, clinics, doctor offices, that includes behavioral health and surgical, but does not include dental offices. It does include congregate living health facilities, dialysis centers, hospice facilities, pediatric day health and respite care facilities, residential substance use treatment and mental health treatment facilities. And so again, it's a wide variety. And the date of that is to have the vaccine series completed by September 30th. And that means sort of shots in arms, but not necessarily fully vaccinated. Then one other state health officer order that happened on August 5th was a visitor vaccine requirement or testing requirement for acute care hospitals, skilled nursing facilities, and intermediate care facilities, basically saying that starting August 11th, all visitors coming in to these sites either have to show that they've been fully vaccinated or demonstrate negative COVID testing within 72 hours. And then finally, just yesterday or just this week, yesterday we had another state health officer order addressing school workers. So now all school workers need to either demonstrate vaccination, full vaccination status, or negative COVID testing. And that's actually effective today. So, you know, that is just what's happened in a little bit more than 2 weeks. And so if any of it's been confusing, it has been confusing. It's sort of layer upon layer upon layer of change. And we recognize and appreciate that, you know, many clinics and hospitals and organizations are really wrestling and struggling with, you know, how to figure out all these things in a very quick manner. And I think some of the questions later on will dive into this. From a data perspective, you know, from a big picture perspective, if we looked back about 10 weeks, you know, our cases have gone up dramatically, and our hospitalizations at the very beginning of June were totaling about 27 across the county. And as of this morning, we had 483 COVID hospitalizations. Our ICU rate is at 89 right now. Our case rate, which was at 1.5 per 100,000, is now 27.5 per 100,000. And the positivity rate, which was as low as 1.1% back at the beginning of June, is now at 12.0%. Now, compared to the surge that we had in January, these numbers are still lower. Our hospitalizations were as high as almost 1,700. And again, we're most recently just below 500. And our positivity was as high as 25. So we're about half of that. And currently our vaccination rate for our county for those 12 and older, we're at 59.4% partially or fully vaccinated and 51% fully vaccinated. And then for those 65 and older, we're at 75.9% for partially or fully vaccinated and 67.9% fully vaccinated. For those of you who might be following kind of the R effective, we've heard that for the Delta variant, the reproductive rate is estimated at around 5 or 6, kind of naturally, without these non-pharmaceutical interventions. And more recently in Riverside County, we saw our R effective climb as high as 1.6 to 1.7. And as of this morning, it's a little above 1. It's at 1.05. And the numbers have been changing quite a bit because a lot of our, you know, it's dependent upon hospitalization numbers and case numbers. And some of these, I would say, are not quite stable yet. If you look at the forecasting for what we expect over the next month, and you average all the different models that the state looks at, you know, the 483 hospitalizations are predicted to rise to about 560 or just under 600 cases by about 1 month from now. And then finally, you know, the Delta variant, you know, we've heard that nationally and statewide, you know, now the Delta variant makes up about 92 to 94% of all the variants detected. And the reason why we don't have more cases identified in Riverside County is it's just a small sampling of the total number of specimens that are sent off for testing, for variant testing. For instance, any of your COVID antigen tests, you know, cannot be sent on for sequencing. And at this point, we're sending off any cases that look like post-vaccination cases. And the previous term was breakthrough case. And we're also sending off, you know, cases in which there might have been foreign travel or cases that might involve healthcare workers. So those are some examples, but it is a sampling, although as a state, we're hoping to get to a point where we're doing much more of that sequencing. And then, you know, in terms of looking at the overall vaccine efficacy, you've probably heard a whole variety of numbers that when you look nationally at all the people who've been vaccinated, only about 0.05% of them have had a post-vaccination infection. In Riverside County, if you look at the hospitals, and this data is still sort of getting cleaned up, But the best data that we have suggests that about 90% of our COVID hospitalizations in Riverside County are happening in unvaccinated individuals. And then, that other 8 to 10% is happening in vaccinated individuals who are largely, either immunocompromised, older, or have a variety of medical conditions. A few other updates just to let people know. We have updated healthcare worker protocols that have recently been just today added to our Riverside County website. And the main change, which reflects the CDC guidelines, is for those people who've been vaccinated. So now if you're a healthcare worker and you're fully vaccinated, and if you've been exposed, you can continue working with a mask. But if you're not vaccinated, if you're under vaccinated, we're still recommending that traditional isolation. The CDC did push out some additional data regarding women who are pregnant, and they now officially recommend COVID vaccination for pregnant women, which is a little bit different than the previous stance when they were saying that, talk to your doctor, and it's not necessarily not safe. So this has been a change. And then finally, we've heard murmurings that the FDA may come out with some recommendations regarding a booster, prioritizing immunocompromised individuals in the next couple of days. So I apologize, that's a lot of talking. I'll stop right there, and then happy to jump into the questions or answer any questions that may come up in the chat. Thank you, Dr. Singhvi.
Thank you, Geoffrey, for update. Did you tell us about the number of deaths in June and now per day, or a breakdown of the age group, what age group or what disease group the deaths are happening?
So, if we look towards the beginning of the pandemic, about 3/4 of the cases were happening in the elderly. And if we look now, about 2/3 of the cases are happening in young adults or younger. And then certainly, we're trying to get better breakdowns for hospitalizations and deaths. The deaths still have kind of a wider spectrum. So even though the cases, the average age has moved from probably about 60 something to about 36 to 38 years of age for the average age for a new COVID case in Riverside County. But the average age in the COVID hospitalized or the COVID deaths, we do not believe has changed as much. And, we can try to bring back some easier to digest data next time.
Great. Let's start with the question. Some of it already you have addressed. The first question is, the state has issued a mandatory COVID-19 vaccination requirement for all healthcare workers. Can you clarify this order, which I think you already did? Does the complete vaccine regimen need to be completed by September 30th? How about second dose or 14-day post-final dose?
Right. So the second dose or the final dose needs to be completed by September 30th. And that's a good question, because technically it means that those individuals are not yet fully vaccinated until 2 weeks later.
How about Johnson & Johnson vaccine?
So Johnson & Johnson, first dose by September 30th.
That's
first
the only dose we'll get, right? Yeah, first and last. What do we do if an employee refuses to get the vaccine and does not qualify for the religious or medical exception?
Yeah. So this is, really left to the individual employer. And this is what, clinics and hospitals are really kind of trying to work through right now. The state is very clear that people who are not fully vaccinated and who do not meet one of those exemptions, should not be working afterwards. But kind of getting into the technical pieces, what does it look like if you're trying to apply progressive discipline? Do you start off with a warning letter? Do you pull people out immediately? Those things, each organization or employer will have to work out.
Mm-hmm. This afternoon, I was talking to Dr. Bakhtiar. He had a question. I hope he had joined the meeting. He said that a lot of patients that refuse to get vaccinated still want themselves to be seen in the office. How do you handle that situation?
Mhm.
Not tele, in person.
Right. So we do, we do know that if the healthcare staff are vaccinated and the healthcare staff are wearing masks and patients are wearing masks, even if the patients are unvaccinated, that presents a very, very low risk for potential transmission. But obviously, our goal is to be able to convince as many of our patients to get vaccinated. So we don't have any official recommendation to, not see unvaccinated people in person. Or kind of flipped around. We do think that, again, if you're protecting your staff and people are following precautions, that, you can continue to see unvaccinated individuals in person.
Great. The next question is the COVID-19 dashboard on the public health website shows the current picture of COVID-19 in our region. However, the historical data doesn't seem to be readily available. Is it available? If it is available, where can it be found? And shouldn't it be a more easily accessible location?
So thank you for that question. So I did put out a question to our team, and there were daily reports that were previously archived and supported by our emergency medical services team. So we have made a request to see if it's possible to bring that back. And we know that there are always things that we can do to make that data a little bit more usable and transparent for everyone. So thank you for that. It's a good suggestion.
Uh, Thank you. The next question is our county sequencing samples of uh, samples to detect the Delta variant? And is this being done broadly or only under certain conditions, and under
Right.
what conditions?
So again, there are probably three main scenarios where we are consistently sending off samples for sequencing. The first is post-vaccination infections. So people who've been fully vaccinated and they're at least 14 days out from their final shot, who are developing symptoms and have a positive test. So those are being sent off for sequencing. Healthcare workers who are getting COVID, they're also being sent off for sequencing. And then people with recent travel to countries with variants are also being sent off for sequencing. Now, there's an argument that, this we should be sending many more specimens off for sequencing. And the state, has shared that they're strongly supportive of being able to do that, but we do need to be able to build up our capacity. And currently the turnaround time for sequencing is probably still slower than most of us would like to see.
Uh, can you explain why Delta variants detected in our county is low?
Yeah, so this is purely a reflection of the sampling and as well as the delay. So, it can take 5 to 6 weeks to get results back. So if you think about 5 to 6 weeks ago, our cases were still relatively low. And actually in April, the percentage of variants made up by Delta were very low. I believe in April, it was less than 10% of our variants were Delta. So we definitely have a delay and a lag factor, and we would expect, that we would see many more Delta variant cases becoming positive, from this month, but that might not come back until next month. And then because we're not sending all of the PCR tests out for sequencing, again, this is only a small sample of the total tests being done.
Great. If we are interested in sequencing samples at our hospitals, how do we proceed?
So, for anybody interested in that, probably the easiest or the best thing to do would be to reach out to our disease control team. Barbara Cole is our expert, and her phone number is 951 358 5107. Again, it's 951 358 5107 for anybody who is hoping to discuss, the ability to sequence samples for whole genome sequencing.
Great. So viewers can contact Barbara at 951 358 5107. Our next question is How concerned are you about the Lambda variant, which appears to be somewhat resistant to the current COVID-19 vaccines in use?
So far, the Lambda variant, makes up a very small number of the total variants identified in the U.S. Not, just a few days ago, it was at about 1,000 identified Lambda cases for the entire U.S. Definitely, we're most concerned right now about Delta because it's much more contagious and it's the dominant strain. But in general, we're worried about kind of the ingredients that can set us up for accelerating the development of any new variants, and really that's kind of a combination of how large that reservoir is of unvaccinated infected individuals kind of continuing to transmit and spread infection, and the higher and greater that is, the more likely it is that we'll have future variants that may be less responsive to the vaccine.
Hmm. Uh, do you have any suggestions on where to refer patients seeking Regeneron? Our hospital has it, but does not have an infusion center. Our emergency department is too busy to administer the infusion on most days.
So, the description right there for that question probably is true for, many hospitals across our county, as well as across the state and the country. Technically, we have a large number of sites in our county that are approved to give monoclonal antibody, and now there's subcutaneous versions, so it should be easier. But the reality is, many groups have found it challenging to do this in a sustainable way because of precisely what we see here. Hospitals are also busier than normal. EDs are busier than normal, and not all of that is from COVID. I did ask our team that kind of fields all the requests for monoclonal antibody, and we have not been getting requests from any hospitals or infusion centers for a while now. So it may just be that there will be a delay, and that we'll start to see this pick up as the cases increase. Nationally, we know that the requests for monoclonal antibody have gone up several fold. But there are, you can go online. There are actually resources that allow you to search out, which sites are approved for doing this. I think the challenge is in practice finding ones that are able to do it regularly.
Is there a subcutaneous version of Regeneron?
Not Regeneron, and I don't want to get into an area where I'm going to say anything incorrect, but there is a monoclonal antibody where there is a subcutaneous version now. Yeah.
I see. Great. Have there been any outbreaks in the schools since the schools are now back in session?
So it looks like, the main challenges that we had during the summer were really with places that were not following the precautions. Largely the schools that were open during the summer were following precautions and we didn't have challenges. But as recently as today, there have been some articles that have come out about, districts in Riverside County in which there have been more than, one or a handful of cases identified. The challenging piece is, sort of that definition of outbreak. So are people reporting district-wide and just happening to report all of the positive cases, or is this happening at a single school? So in terms of, major outbreaks at schools, right now they've probably been isolated more to groups involved in youth sports. But again, largely for regular school activities where people are following precautions, we haven't seen any major challenges.
Very good. I'm done with the previously sent questions. Richard, do we have anything in chat box? Can you go over the questions in the chat box, please?
Thanks, Dr. Singhvi. So if anyone has any other questions, we do have a little bit of time left if you'd like to put your questions in chat. The first question deals with the healthcare vaccine mandate for, does that apply to EMS staff?
So at this time, it does not apply to EMS staff. The state has had some discussion about, whether in a next round it would apply to either some or all EMS staff, but at this time it does not apply to them.
How about school teachers?
So school teachers are now part of the latest state health order, in which they need to either demonstrate full vaccination or recent negative COVID testing weekly.
Now we have a comment that LA County has included dental offices in the, for the healthcare providers. Was that a decision individually, or is that something Riverside County is considering?
So that is something that LA County announced today. We did not know that was going to happen, and they have expanded their definition of healthcare workers. So you know, we always watch closely what happens in LA County, and sometimes that can help pave the way or make it easier for others to follow suit. But in Riverside County in general, our stance has been to really align with the state, and a good part of this is because many of these changes are confusing enough as it is. So, you know, I would anticipate that if the state were to add on additional groups, then we would follow suit.
So are there any new recommendations about the type of mask to be used in a healthcare setting as a result of very high viral loads and shedding in the Delta variant?
Yeah, so, you know, with the more recently, you know, the Cal OSHA guidelines specifically sort of highlight respirators. There is a little bit of controversy around this, but, you know, there is language, you know, that, and this was before the vaccine mandate came out for healthcare workers, but there was a strong suggestion, or there was a recommendation or requirement actually, that employers be able to offer N95 type respirators to unvaccinated healthcare workers. That may become moot or much less of an issue now that we have the state mandate on vaccination for healthcare workers. And then prior to that, you know, 2 or 3 months ago, there was actually a few months ago to several months ago, there was more discussion about things like double masking, but really in a healthcare setting, the standard is still surgical masks, and then it's certainly okay to use an N95.
Okay, we do have a couple more questions, so we're going to go over time. Do you have a few more minutes, Dr. Leung?
Yeah, absolutely.
So since the outbreak of the Delta you know, variant, have we seen in Riverside County a pickup of vaccinations?
We have. So we've seen a gentle rise in vaccinations administered and sort of appointments requested.
Can you give us an update on the recommendation for a third dose of the COVID vaccine boosters?
So we don't have official word yet, but you know, Dr. Fauci has alluded to this, and others have too, that we are expecting the FDA to announce something soon, and it will likely be regarding a booster for immunocompromised individuals.
Okay, it looks like we have one more question. Any input on availability of rapid COVID testing for in-office? We are told there's not enough testing kits available.
So this is the concern that, you know, all of us have right now with this, you know, sudden requirement for large scale testing. So short term, it does look like, you know, there are rapid COVID tests available through the county, but our concern is what happens after the next few weeks. So our recommendation is probably to have a plan A and a plan B, and at least within the county system, you know, we're trying to look at what we would use if we did not have access to any of the rapid tests.
Thank you. Dr. Singhvi, that was the last question.
Dr. Leung, on behalf of Riverside County Medical Association, we sincerely thank you and your staff who have done a tremendous job. And I think Riverside County is one of the foremost counties which have kept all the health personnel informed, and the credit goes to you and your staff. We'll be talking to you next month on Thursday evening. I think it's second Thursday. We'll be sending the information to our members. Thank you very much. Have a good evening, everybody, to all my colleagues and staff.